Seniors, 5 reasons your legs are getting weaker after 60. Aging is a beautiful part of life, but it can also bring challenges, and one of the most common issues seniors face is weakening legs. Have you noticed that it's becoming more difficult to stand, walk, or climb stairs? Maybe your knees ache after a long walk, or you find yourself avoiding physical activities that once brought you joy. It's a well-known fact that as we age, many parts of our bodies start to change. Leg weakness after 60 is one of the most significant signs of aging that affects both men and women. The good news is that weak legs don't have to be an inevitable part of aging. By understanding why your legs are weakening, you can take steps now to reverse or slow down the process and live a more active, independent life. In this comprehensive guide, we will explore 5 key reasons why your legs may be getting weaker after 60, and more importantly, what you can do now before it's too late to reverse these trends. 1. Age-related muscle loss sarcopenia. Sarcopenia is the term used to describe the gradual loss of muscle mass and strength as we age. It's normal to lose some muscle as you get older, but excessive muscle loss can make your legs feel weaker and less stable. Why this happens? After 30, we start losing about 3 to 5% of muscle mass per decade. By the time you reach 60, this loss can become more pronounced, especially in the lower body, which carries the bulk of your weight. The legs are used constantly for walking, standing, and balancing, which makes them particularly susceptible to muscle loss. Signs of sarcopenia: difficulty walking or getting up from a seated position, noticeable weakness in the legs, especially after a workout, increased fatigue after standing or walking for extended periods, loss of muscle definition in the legs and thighs. How to prevent or reverse sarcopenia. Strength training. One of the most effective ways to combat muscle loss is to engage in resistance or strength training. Activities like squats, lunges, leg presses, and leg curls can build muscle strength. You don't need heavy weights. Resistance bands or bodyweight exercises, like wall sits, can also be highly effective. Protein-rich diet. Adequate protein intake is crucial for muscle repair and growth. Seniors need more protein than younger adults because their bodies have a reduced ability to use protein efficiently. Aim for 1.0 to 1.2 grams of protein per kilogram of body weight each day. Vitamin D. Vitamin D is essential for muscle health. Low levels of vitamin D can exacerbate muscle weakness. Sunlight, fatty fish, fortified foods, and supplements are good sources of vitamin D. Consistency is key. Even if you're not feeling weak, make sure to engage in regular physical activity, including strength training, to maintain your leg strength. 2. Sedentary lifestyle. After 60, many people tend to slow down, either due to physical limitations or a natural decrease in energy. However, sedentary behavior can significantly contribute to leg weakness and muscle atrophy. Why a sedentary lifestyle hurts your legs? Lack of movement means your leg muscles aren't being challenged and stimulated. Muscle disuse leads to atrophy, and over time, you may notice that your legs feel weaker, making it harder to perform everyday tasks such as walking, standing, or climbing stairs. Consequences of sitting too much: poor circulation, which can cause leg swelling or discomfort, stiffness in the joints, especially the hips and knees, loss of flexibility and balance, increasing the risk of falls. What you can do about it: increase physical activity, incorporating regular walking, swimming, or cycling into your daily routine can make a world of difference. Try to aim for 30 minutes of moderate intensity activity 5 days a week. This can be broken up into shorter segments if necessary. Stretching and mobility exercises. Incorporating daily stretching can help improve flexibility, reduce joint stiffness, and alleviate leg cramps. Consider stretches for your hamstrings, quadriceps, calves, and hip flexors to keep the muscles and joints in your legs loose and flexible. Take short walks. If you've been sitting for an extended period, get up every 30 minutes and walk around for at least 5 to 10 minutes to get your legs moving. Even this small activity can make a significant difference in circulation and leg strength. 3. Nutritional deficiencies. As we age, our nutritional needs change. A poor diet or nutrient deficiencies can contribute to weak legs and muscle loss, increasing the risk of falls and other physical limitations. Key nutrients for leg strength. Several key nutrients are essential for maintaining strong muscles and bones. Without these nutrients, your legs can become more prone to weakness, cramping, and injury. Protein. Critical for building and maintaining muscle mass. Vitamin D supports bone health and muscle function. Calcium, necessary for strong bones and muscle function. Magnesium and potassium, important for proper muscle contraction and preventing cramps. What happens when you don't get enough? Low protein results in muscle wasting and less strength. Vitamin D deficiency leads to weakened bone. Supplement wisely. If needed, take vitamin D, calcium, and magnesium supplements to meet your needs. Consult with a healthcare provider before starting any new supplements. Hydration. Stay hydrated by drinking plenty of water throughout the day. Dehydration can worsen muscle fatigue and cramping. 4. Chronic health conditions. Chronic health conditions are more common as we age, and they can significantly impact leg strength and mobility. Conditions like arthritis, diabetes, and cardiovascular diseases can lead to leg weakness, fatigue, and pain. How chronic conditions affect leg health. Arthritis causes joint pain and stiffness, particularly in the knees, hips, and lower back. Diabetes leads to nerve damage, peripheral neuropathy, resulting in weakness, numbness, and poor circulation. Peripheral artery disease pad. Narrowing of blood vessels in the legs can cause cramping, pain, and poor circulation. What you can do about it. Work with your doctor. If you have a chronic condition, it's crucial to manage it properly. Regular checkups and adherence to medication can help control the condition and improve leg strength. Physical therapy. Specialized therapy can help you regain strength, flexibility, and balance in your legs, despite chronic conditions. Cardiovascular exercise. Gentle activities like walking, swimming, or cycling can improve circulation and heart health, benefiting the legs. 5. Neurological disorders. Neurological conditions like Parkinson's disease, stroke, and multiple sclerosis (MS) can cause muscle weakness, balance issues, and leg fatigue. These conditions directly impact the nervous system, which controls muscle movement. How neurological disorders impact legs. Parkinson's disease leads to stiffness, tremors, and slowed movements, all of which can make leg movement difficult. Stroke can cause paralysis or weakness on one side of the body, affecting leg strength. Multiple sclerosis damages nerve fibers, leading to weakness, loss of coordination, and muscle fatigue. What you can do about it. Early diagnosis. If you experience symptoms like tremors, numbness, or weakness, consult a healthcare provider for early intervention. Rehabilitation. Work with physical therapists who can tailor exercises to your specific needs, improving leg strength and mobility. Conclusion. Leg weakness after 60 doesn't have to be a permanent issue. By understanding the reasons behind it and taking proactive steps now, you can maintain and even improve your leg strength, mobility, and overall quality of life. Whether through strength training, addressing nutritional deficiencies, managing chronic conditions, or seeking medical advice, there are numerous ways to fight back against leg weakness. Remember, the earlier you start, the better the results. Don't wait for things to get worse. Take action today to ensure that your legs stay strong and healthy for years to come.